Hi, Hazel Mansfield. How are you?
I'm very well, thank you. How are you, Sandra?
Very well, too. First of all, thank you for participating in our online International Virtual Students Day in Ocean.
Yep.
It's a real pleasure to have you with us, and we would like you to tell us a little bit more about you and the school you teach in, your topic, etc. So if you can tell us a little bit more, it would be great.
Yeah, absolutely. So yeah, my name is Hazel Mansfield. I teach at the Skandinaviska Osteopath School in Gothenburg, Sweden, and also consult in private osteopathic clinic in Stockholm. This is after many years in London, where I trained as an osteopath.
Okay, so you have a British background and you're working and teaching in Sweden, right?
I do. That's correct. Yeah.
And what's your topic about?
So my topic, I'm going to be talking about central sensitization at the student day. This is a concept that very much applies to osteopathy, and specifically being able to understand those patients that have chronic pain. I've been treating patients for about 15 years, and a large number of those patients have chronic pain, i.e. pain that's experienced for over 3 months. And in fact, studies looking at this show a prevalence of up to around 25% of musculoskeletal pain, particularly common in women. So students will be seeing a lot of this in their future clinic. My background is in neuropsychology. I did a degree at Cambridge University before training as an osteopath. So combining these two fields is something I'm really passionate about in both in my clinic work, but also in my academic teaching as well.
Very interesting. Actually, I think that that's one of the most important fields nowadays in osteopathy. How
Yes.
can we apply neuroscience into our clinical practice? Because it's not just theory,
Absolutely.
right? So
Absolutely.
why do you think that students should follow your lecture? What will they learn from a practical and clinical point of view?
Yeah, absolutely. Well, as I said, chronic pain is common. And I really believe that until you understand some of the mechanisms at play behind chronic pain, such as central sensitization, it's actually really difficult to treat these patients effectively. It's helpful to lean into the fields of neuroscience and psychology just a little bit to boost our osteopathic care and clinical thinking. And I think it also, perhaps helps build a better understanding of how what we do with our osteopathic treatments really helps our patients. And it may even assist you in finding more novel ways of applying our techniques and osteopathic thinking in patients who aren't responding to treatment. So my talk is really aimed at a very accessible level, with some key takeaway points to think about later in clinic when helping patients with chronic pain. You're going to learn some of the features of chronic pain and why it matters, how to identify central sensitization and what really to consider and look at when treating these patients. So for example, how can you use your manual techniques more effectively? What kind of advice or exercises even you might give to these patients? So understanding your patient better will lead to a more successful treatment. So I really think my talk is one not to miss.
I totally agree. I think it's a key point nowadays.
Yeah.
So thank you very much, Hazel. See you in our International Virtual Students Day, and I'm sure that everybody will enjoy very much your lecture. Thank you.
I hope so too.
Bye.
I look forward to seeing you then. Bye-bye.